Go.
All right, I'm looking for any precaution signs, any exposure signs. I don't see any, so I'm going to go ahead and knock on the door. Knock, knock. Hi, my name's Angela. I'll be your student nurse today. I'm looking around for any fall risks. I don't see any. Everything looks nice and clear here. I'm going to go ahead and sanitize my hands. Can I get your name and birthday, please?
Yes, Tia Jody, June 11, 2004.
All right, perfect. And how would you like to be addressed today?
Oh, Tia is fine.
Tia is fine?
Yes.
Okay. And Tia, do you know where you are?
Bellevue College Hospital.
Bellevue College Hospital. And do you know the date and the month and year?
Yes, July 21st, 2024.
Okay. Face looks symmetrical. Eyes look great and clear. No drooping in the face at all. She's alert and oriented ×4. Okay. What brings you in today?
Just a checkup.
Just a checkup? Okay. And I did see somebody came in and did your vitals. Is that correct? All right. And are you in any pain right now?
No.
No? Okay. So 0 to 10, it would be
A 0.
A 0?
Yeah.
Okay. Also, I do have a few questions before we get started. I'm here to do your head to toe assessment, and I'll let you know each part of the body that I touch, okay? And do you have any cultural preferences?
Oh, no.
No? Okay. Do you have any allergies?
Nope.
No? Any shortness of breath, coughing,
Nope.
wheezing, none of that? Any asthma? No? Do you have any headaches, dizziness, tingling in your fingers or toes? No? Do you smoke any tobacco, drink alcohol, any other intoxicant?
Nope.
Okay. Do you have any anxiety?
Nope.
Do you have any thoughts of harming yourself or others? No. Do you use an incentive spirometer or oxygen at home? No. Everything's good? Okay. Let me go ahead and lift the bed, okay?
Okay.
Oh, I'm sorry.
Oh, you're good.
Alright. And do you use any assistive devices such as glasses, dentures, hearing aids? No? Okay. So I'm going to go ahead and start by feeling the back of your neck, okay?
Sure.
So it's going to be here. I don't feel any lumps or bumps. Skin is warm and dry. Hair is evenly distributed. Skin color on face matches. Is appropriate for ethnicity. All right, and I'm going to have you go ahead and push your hands. All right, that was cranial nerve number 11 that I just tested. Go ahead and look up for me. I'm looking at the trachea line. It is midline, so we are good. Go ahead and turn to the left. No JVD. Turn to the right. Perfect. I'm going to go ahead and feel for your artery, your carotid artery here. All right, nice and strong. I'm going to feel here, nice and strong. Okay. Go ahead and look up. I'm going to have you go ahead and close your eyes. I'm going to test for cranial nerve number 1. Number 1, which is smell. Go ahead and tell me what you smell.
Alcohol.
Perfect. And keep your eyes closed for me. I'm going to do cranial nerve number 5 and 7. So can you tell me what you feel?
Right forehead.
Right forehead. Okay. And here.
Left forehead.
Perfect. And here.
Right jaw.
All right. And here.
Left jaw.
And here.
Left cheek.
Perfect. Go ahead and puff out your cheeks for me. Perfect. Go ahead and open. Oh, I'm sorry. Go ahead and keep your eyes closed.
Okay.
I'm gonna listen. I'm gonna go ahead and test cranial nerve number 8. Okay.
Okay.
Can you tell me what you hear?
Yes, whooshing sound.
Thank you. On what side?
Left ear.
Okay. And just
Same sound on the right ear.
okay.
And then both ears.
Perfect. Go ahead and open your eyes. I'm gonna test cranial nerve number 2, 3, 4, and 6. Can you tell me what you see over there?
The welcome sign.
Okay. Perfect. And then I'm gonna have you go ahead and follow my pen with your eyes. Down. Middle, perfect. I'm gonna have you go ahead and look past me right here. Perfect. Both pupils react to light. Okay, go ahead and lift up your eyebrows for me. Lower them. Go ahead and frown for me. Smile. All right, and then stick out your mouth or stick out your tongue. Can you wiggle it back and forth? Perfect. And then can you open your mouth for me? All right, mucous membranes are pink. I don't see any sores or lesions inside the mouth. And then I'll have you say ah and try swallow for me, please. Perfect. All right. So I'm going to have you go ahead and hold out your arms for me like this. And I'll have you push down. Perfect. Go ahead and turn your hands around and push up. And that was to see you're strong. Do you feel any sensation here?
Yes.
How about here?
Yes.
Okay, go ahead and turn your hands around. I'm going to feel your radial pulses. Both of them are strong, equal bilaterally. And I'm going to have you go ahead and feel your brachial, radial, brachial, equal and bilateral. Equal bilaterally. All right, and then I'm going to look for your capillary refills. Looks good. Looks good. I don't see any IV sites, any PIC lines so far. So are you having any chest pains at all? Nope. No? Okay. So I'm going to go ahead and assess your chest. It looks, I'm going to pull this down a little bit. For video purposes, she has clothes on, but we will be looking under her gown would be completely nude. I don't see any issues with the symmetry of your chest. I'm going to go ahead and palpate, which is touching your, okay? You not feeling any crevices. All right, I'm going to go ahead and feel here. Everything looks symmetrical. So I'm going to palpate your aortic pulse. Perfect. And then I'm also going to palpate your pulmonic pulse. And the tricuspid. So I'm going to go right here. And then I'm going to go under, okay? Perfect. Okay, and now I'm going to go ahead and take a listen with my stethoscope. Okay, go listen here. I'm hearing normal heart sounds. Normal heart sounds. That was also the pulmonic. This is the tricuspid. Perfect. Go ahead and look here. And go right under to the mitral. I'm also going to turn my bell around and go back up the same way. Oh, I'm sorry. Okay, I'm not hearing any murmurs, any dysrhythmia. Okay. Alright. So now I'm going to go ahead and see that she is having normal respirations so far. I'm going to listen to your breathing, okay? Okay. So we'll keep it.
Hi, my name is Kate. I'm the nurse today. How are you doing? Fine. Okay, could you verify your first, last name, and date of birth?
Dating for November 29th, 1989.
Down here.
How would you like to be addressed?
And here. And then I'm going to have you lift up your arm.
Tell me what
And I'm going to listen to the right third lobe. Perfect. I'm also going to listen to the left, middle lobe.
Okay.
And all this would be done under the gown.
All right, so we'll talk about it in a few seconds. So I'm
Okay.
just going to do
So I'm going to lower the bed a little bit.
Is that okay?
We're going to have you come to the edge of the bed. And we'll have you sit back a little bit higher.
Okay.
Okay. I'm going to come behind you, okay? Okay. Alright. I'm going to feel for symmetry, so go ahead and take a deep breath. Perfect. Chest expansion is
So tell me
good.
a little bit more about the
I'm
pain.
just going to go ahead and palpate the back, feeling crevices in the air, nothing. Everything seems normal. I'm going to listen
How would you rate your
to your breathing. So this is where you would take deep breaths. Each time you feel my
Any
stethoscope.
triggers?
And I would go down.
Sometimes when I like sit up, it just kind of like just kind of stays.
Anything that helps to ease the pain?
Here.
Tylenol, I think.
Right under it.
Just like not touching.
Nipple line. Right here on the right.
Rate your pain level.
And everything sounds good. Normal breathing sounds. Okay, I'm going to have you go ahead and lay back down. I didn't know any skin breakdown as I was looking on bony prominence. All right, this is going to go ahead and inspect your abdomen. So I'm going to lift up the bed again, okay?
Any recent hospitalizations?
And I'll lower the.
The hospital like 2 years ago.
Okay. So I'm going to lift up and I would inspect the abdomen. I don't see any scars, wounds. Skin is warm and dry to touch. Same color as the rest of her skin and appropriate for ethnicity. I'm going to go ahead and listen.
Experience any dizziness, lightheadedness?
I would start with the right lower quadrant. and then I would listen to that for 1 minute. I would move to the right upper quadrant, and I would listen to that for 1 minute. Upper left quadrant, listen to that for 1 minute, and lower left quadrant, and then I would listen to that for 1 minute. If I didn't hear any sounds, I would listen for 5 minutes. If I still don't hear any sounds, it would be considered an emergency, and I would go get the provider. No abdominal pain, no vomiting, diarrhea.
Nope.
No? And your bowel movements are normal? What color would you say?
Brown and just normal.
Okay, I'm gonna go ahead and palpate. Okay. Do you feel any pain with that? How about that? And that? And that? Okay, I'm gonna do it again just a little bit deeper and let me know if you feel it while I let go, okay? Any pain? No. Any pain? Any pain? How about now? Okay, and this is where I would ask, do you have any urinary issues, any frequency burning, odor, color changes to your urine? I notice that you do not have a fully in because you can urinate perfectly, and this is where I would palpate the bladder. Okay, I'm gonna come down here. I don't see any IV sites. So I'm gonna go ahead and, do you feel that?
Yes.
How about that?
Yes.
Okay, I'm looking at her skin. Her skin is warm and dry. I don't notice any edema. If I did, I would be testing for the depth of pitting edema. So I'm going to go ahead and have you push your feet on my hands. Go ahead and push down. Perfect. I'm going to feel your pedial pulses. Both of them are equal strong bilaterally. And go ahead and feel for your tibial pulse. Both of them are equal and strong bilaterally. Capillary refills. Okay, everything looks good. So now we're going to go ahead and have you stand or sit at the edge of the bed for 30 seconds. Are you feeling any dizziness, lightheaded? No. You're okay? All right, go ahead and stand up for me, and I'm going to have you put your feet together as much as possible, and I'm going to have you close your eyes. And this is where I'm going to have you stand for 1 minute to see your gait. I don't see any swaying. Any movement at all, so she looks straight and even. All right, go ahead and open your eyes. And I'm going to have you go ahead and walk me from toe to heel 5 times, okay?
Yeah,
Here we go. This is the Romberg test. I do see that she's walking very in a straight line. I don't see any breakdown, like I said, and then on the elbows, back of the knees. All right. Okay, I'm going to have you go ahead and lay back down.
Oh.
I'm going to lower the bed. And here is a call light. Do you need any of your possessions at all? Do you need to use the restroom at all? Okay, so here's my call light. If you need me at all, I will be in here quickly, okay?
Okay, sure.
Okay, thank you.
Yes.
All right.
5 and 7. Okay, so could you please close your eyes?